get the feeling you might be in the right place when you got notes that you reviewed several times. And it starts with good afternoon, and it's 11 o'clock in the morning. So I'm sure there aren't a lot more of those type things. Hello, my name is Robert Andrews. I'm the chairperson of the Board of Trustees. And it's my sincere pleasure on behalf of the board to welcome you to Newfoundland and Labrador Health Services inaugural annual general meeting, and my first as chair of the board. Today we will provide an update of our progress, some of the accomplishments and challenges during the first fiscal year at NL Health Services. But first, I will start with a land acknowledgement, which is offered to recognize the enduring connection of Indigenous people to their traditional territories, to recognize the history of the land that is currently shared by many people, and to recognize stewardship as a shared commitment of all those who reside in the territory. The practice of territory acknowledgement is in itself a replication of an Indigenous practice which predates European contact. We respectfully acknowledge the territory in which we gather as the ancestral homelands of the Beothuk and the island of Newfoundland as the ancestral homelands of the Mi'kmaq and Beothuk. We would also like to recognize the Innu of Nunavut and Nunatukeavut and the Innu of Netassawin and their ancestors as the original people of Labrador. We strive for respectful relationships with all the peoples of this province as we search for collective healing and true reconciliation and honor this beautiful land together. Our board has taken steps to, as we meet in various places in the island, to make sure that we personally get to meet with the Indigenous members of our community. We think that it's important. I think it's going to lead to a lot of changes in the way we deliver healthcare. I welcome everyone attending in person today, as well as those who are joining virtually on our live stream. The AGM will be recorded, so anyone who could not be here will be able to watch the recording once we post the link to the NL Health Services website. Following the AGM, we will take questions from the audience. For those online, we invite you to email your questions for the Q&A portion of the AGM to, and here's that stuff we've learned to do in more recent years. The email address is all capitals AGM at all lowercase nlhealthservices.ca. I'll begin by extending a warm welcome to NL Health Services employees, physicians, and volunteers. On behalf of the Board of Trustees, I express my gratitude to each of them for their dedication, compassion, and resilience as we continue our transition to a single provincial health authority. Next, I would like to thank our health foundations and auxiliaries for their continued acts of kindness and giving. This generosity greatly impacts our patients, families, community, and organization, and I thank those chairs who are joining us either in person or virtually today. I'd like to recognize my colleagues on the Board of Trustees who have joined us today, and I ask that they stand as I call out their name. They've not been forewarned of this, so. Michelle Bakey, Dr. Catherine Bradbury. We have one member who recently resigned because she moved out of the province, but I'd like to acknowledge her name at least, Janet Bradshaw. Sharon Forsey, Edward Gowdy, Colleen Hanrahan, Tara Lang, Candace Matthews. It gets easy from here on, they're all David, except for the last. David Oxford, Dr. David Sutherland, who's online, I assume, and David Thornhill. And last but not least, my Vice Chair, Lloyd Walters. Newfoundland and Labrador Health Services is governed by a board of trustees, all of whom are accomplished individuals from a wide range of backgrounds and communities. There are no wallflowers on this board. They all speak very freely what they think and give their contribution. Thank you all for your guidance, passion, leadership, and devotion that you bring to your governance role. I welcome Ms. Karen Stone as our interim CEO. It has been a pleasure working with her since she started with NL Health Services, and working together, I'm looking forward to advancing healthcare in this province and improving health outcomes for all those we serve. I also want to acknowledge and thank Mr. David Diamond, who until the end of June served as the first CEO of NL Health Services. David was instrumental in leading the transition from 5 entities into one provincial authority. He was our walking record of where we came from and where we're going. The accomplishments we are reporting today came under David's leadership. I greatly valued his leadership, his insight, and his advice to the board during the first year. I also valued his friendship. We wish him well in retirement, and I know he hasn't gone out of reach to us or anything that we feel he can contribute. I'm sure he's available to us. As well, I thank the members of the NL Health Services executive team. Your leadership has been and continues to be invaluable. I also want to acknowledge and welcome our partner in all this work, the Department of Health and Community Services, Minister Hogan, whom you'll hear from later, Deputy Minister John McGraw, and the Deputy Minister of Transition, Dr. Pat Parfrey. Dr. Hogan hasn't been in the health department long enough yet for me to have worn out his phone, but the other two have heard from me regularly and are always available to members of NLHS on their, when the board is carrying out its duties. Last but not least, I welcome members of the public, community partners, and the media who have joined us today. Thank you for attending. The public are why we do all of this. It is now my pleasure to invite the Honourable John Hogan, KC, Minister of Health and Community Services, to the podium to speak on behalf of the Government of Newfoundland and Labrador.
Good morning, everyone. Bob, I don't know if you noticed, but you called me Dr. Hogan.
Just wait long enough.
So the funny thing is the Premier called me Dr. Hogan this week too. So I'm going to take that as a compliment that I'm perhaps learning what's going on in health and community services, and maybe I'm starting to know what I'm talking about. As all you in the room do and have for a long time. So really, very much I want to thank you for inviting me to be part of this annual general meeting, and it is a pleasure to be here as Minister, not as a Doctor of Health and Community Services. As everybody knows, 2 years ago, the government established Health Accord NL to reimagine our health system to meet the needs of the healthcare for all Newfoundlanders and Labradorians. And we set an ambitious goal to make Newfoundland and Labrador one of, if not the healthiest provinces in Canada by 2031. We want to create a health environment in this province that places greater emphasis on well-being, social determinants of health, which will help achieve better health outcomes for everybody. And I want to take time now to thank you all for being part of the progress that has been made since the Health Accord has been implemented, which is our 10-year plan to reimagine and transform healthcare in our province. In the last 2 years, we have made significant progress, and we're hearing from people who can see and feel the progress that has been made. And it is because of your commitment and dedication to healthcare in Newfoundland and Labrador that we're seeing and hearing about this progress. There's more physicians, more paramedics, more nurses living and working in this province than there were 2 years ago. Virtual care is available to help ensure more people can go to rural emergency departments and get the care they need virtually and locally. Nursing schools and the Faculty of Medicine are expanding to accept more people, which is going to lead to more physicians and nurses here in the province. Family care teams have more than 60,000 patients and are employing more than 240 people. So they can see a nurse practitioner, family physician, or nurse or another healthcare professional based on their health needs. We all know there's more work to be done, but please know that you are making a difference in the lives of Newfoundlanders and Labradorians, and we are getting there. We are well on our way to the transformation of healthcare in Newfoundland and Labrador. And I want to thank all the members of the board, all the staff, and all the healthcare professionals throughout the province of Newfoundland and Labrador for helping accept Health Accord NL, and most importantly, help implement it and progress towards a healthier Newfoundland and Labrador. Thank you.
Thank you, Minister Hogan. I can be trained. I thank the provincial government for the close partnership that we have as we work to improve the health and health outcomes of the people of the province. Much of what we do is in consultation with your department, as well as others in government. As our main funding partner, many important initiatives, some of which we will outline today, are possible thanks to your support. Thank you for being with us. I'd now like to invite Ms. Sharon Forsey, Finance and Audit Committee Chair, to provide our financial report.
Thank you, Bob, and good morning, everyone. Mr. Andrews, Ms. Stone, Minister Hogan, fellow board members, invited guests, and staff. I'm pleased to present for adoption at this annual general meeting the financial statements for Newfoundland Labrador Health Services for the fiscal year ended March 31st, 2024. These financial statements have been audited by the Office of the Auditor General, and I'm pleased to report that the auditors have expressed an unqualified opinion on these statements. For the fiscal year 23-24, Newfoundland Labrador Health Services cash-based operation expenses were $3.4 billion. Of the $3.4 billion, 75%, or approximately $2.5 billion, was spent on direct patient care. The other areas of expenditures include support, administration, research and education, and other matters. A detailed breakdown of the NL Health Services finances can be found in the operating revenue and expenditure section of our annual report, as well as the full financial statements, both of which are available on the NL Health Services website. During the fiscal year 23-24, NL Health Services incurred an operating cash deficit of $310 million. I would like to take this opportunity to thank the members of the Finance Committee and the Board of Trustees for their support and commitment during the year in overseeing the finances of NL Health Services, as well as the over 22,000 employees and 1,100 physicians, including our new interim president, Ms. Stone, the CEO, our executive team and staff for their work and dedication. Mr. Andrews, for the upcoming fiscal year, as per the Auditor General Act, the Office of the Provincial Auditor General will be auditing our financial statements. Mr. Andrews, I move the adoption of the audit of financial statements for NL Health Services for the fiscal year ending March 31st, 2024. Thank you very much. That concludes my report.
Put that to a vote. All those in favor? Contrary? Carried. This AGM provides an opportunity for Newfoundland and Labrador Health Services to reflect on the significant efforts made to help achieve the mandate and strategic priorities of Newfoundland and Labrador Health Services. For our first AGM, we have included a showcase to feature some of the important advancements we have made over the last year. Note that's some of the important advancements. There are too many to go further. There are 24 displays in the showcase of 24 different sorts of accomplishments, but there could have been many, many more. So we give those for a flavor of the good things that are happening. If you haven't had a chance to review these storyboards and speak to our staff members, I encourage you to visit the showcase once we conclude the AGM. It's in the room right across the hall. For now, I will share with you some examples of the many highlights and partnerships of the past fiscal year, which show a range of areas that we address. For many people, when you need immediate health care, they may want timely access to services such as emergency care. We are working diligently to make improvements to emergency care. We have established virtual emergency rooms in many areas with recruitment efforts ongoing. As well, work continues to renovate the Health Sciences Center Emergency Department in St. John's. Once completed, it will be equipped with state-of-the-art technology that will significantly enhance the patient's experience by reducing wait times, improving diagnostic capability, and streamlining treatment processes. Additionally, the modern layout will be designed to not only enhance patient comfort, but also foster better engagement among our staff, promoting collaboration and efficiency. This environment, coupled with the latest technology, will enable continuous quality improvements, ensuring that care standards evolve to meet the highest expectations. And having spent several hours in the emergency room myself, I know how high those expectations get. So we're aiming to make that a much better service based on things that we now know are available, and we're making the effort to make sure they're there for you. These advancements will lead to faster, more efficient care, ensuring patients receive the attention and treatment they need with greater comfort and confidence. We've also taken into consideration the different needs of patients when they visit the emergency department at the new Western Memorial Regional Hospital. The layout separates the department into triage, fast track, and emergency care versus the adjacency and shared space that existed in the legacy site. The triage area identifies those who have lower acuity and needs to wait for the fast track, where they are seen by a nurse practitioner and licensed practical nurse. The patients who require more urgent critical care go directly to the emergency department or wait for emergency provider in a waiting room where they are visible to the emergency nursing staff. Other improvements to emergency care include the provincial integration of ambulance services that became effective last June. And I repeatedly point out, on June 1st, the same day that we took over the ambulance service, we also opened Western Memorial Hospital. So, two very large projects that went virtually unnoticed because they were done right by our people out there. I thank them very much and continue to do so. At the time, Newfoundland and Labrador Health Services assumed operation and management of all ambulance services across Newfoundland and Labrador. This integration provided our patients, clients, and residents with added benefits through the standardization of service delivery and expansion of ambulance services beyond emergency response into such areas as community paramedics and paramedics in palliative care programs. Another point of contact people have with healthcare is through their primary healthcare provider. We've been working towards establishing family care teams in the province as a priority from the Health Accord. To date, 23 teams have been approved by the Department of Health and Community Services. Currently, 16 teams are partially or fully operational, and they're currently connecting patients and are focused on recruitment and team building. The remaining 7 teams are in the planning stages. Family care teams, for those who may not be familiar with them, represent a significant shift from the solo-based community practice and program-based models of service delivery to an interdisciplinary, that's a hard word to say, team-based model. Family care teams offer seamless access to multiple healthcare professionals in one setting and through integrated referred pathways with other community and health programs, for example, mental health and addictions. Family care teams provide a framework to reorganize and expand on existing community-based health services and to modernize and increase the adaptability and agility of the Newfoundland and Labrador health care system. Importantly, family care teams respond to the dynamic and diverse needs of the population and are an innovative solution to support the delivery of primary health care. NL Health Services has also made tremendous progress in using available operating room time to increase access to surgeons, such as hip and knee replacements. In the eastern rural zone of the province, starting in September 2023, and in just 6 months of the last fiscal year, more than 100 inpatient hip and knee replacement surgeries were completed at Carbonear General Hospital. And since then, we have completed nearly another 100 surgeries. We've increased volumes at this site up to 8 hip and knee replacement surgeries per week, with plans to further expand by adding a third operating day to the program. This is something that would not have been easily available with the divided system that we had previously. This could be planned and implemented with relative ease. And as a result of this, we now also have a dedicated orthopedic surgeon has been successfully recruited for the site to support this expansion. In addition to the Carbonear initiative, an orthopedic surgeon in the eastern urban zone travels to St. Anthony 1 week per month to use available OR time there for hip and knee replacements. This initiative facilitated more than 100 joint replacements in 23-24. Last year, we took steps to expand and enhance cardiac and stroke care across the province in partnership with the Department of Health and Community Services. One such step is the Heart Force One pilot, which provides cardiac patients with timely access to catheterization procedures without overnight stays. It offers a same-day fly-in, fly-out service for patients from other regions to access procedures available only in St. John's. We also took steps to enhance cancer care to support better patient outcomes. NL Health Services was Canada's first cancer care program to join the Princess Margaret Cancer Care Network. This collaboration as a network partner site provides enhanced expertise, resources, education, and research to benefit patients of the Provincial Cancer Care Program and their caregivers. NL Health Services, in collaboration with the Department of Health and Community Services, made considerable progress in supporting healthy aging across Newfoundland and Labrador last year. I laugh because I know that includes me now. NL Health Services established a targeted focus on improving care for older adults and supporting healthy aging in place, including creating senior-friendly hospitals and establishing acute care of elderly units at St. Clair's Mercy Hospital in St. John's and Western Memorial in Corner Brook. One of our greatest challenges throughout the transition into NL Health Services was the recruitment and retention of our workforce. In partnership with the provincial government, NL Health Services has taken innovative approaches to address the critical need for skilled healthcare professionals across the province, resulting in the successful recruitment of over 200 internationally educated nurses. In addition, over 600 internationally educated nurses are currently being recruited throughout the ongoing initiatives. Since January 2023, we have welcomed over 300 internationally educated nurses at NL Health Services. We have also increased the number of physicians by 161 that same period. As well, 203 Bachelor of Nursing students and 167 practical nursing students have accepted job offers and are working across NL Health Services. I'm also happy to share that the Health Sciences Centre in St. John's has been recognized as the first hospital in Canada to achieve quality improvement status by Choosing Wisely Canada. The new designation honors hospitals that actively work to reduce unnecessary medical procedures, minimize waste, and improve the quality and safety of patient care. As you'll see in one of the boards outside, last year the Correctional Health Services team received funding of $1.4 million from the provincial government to begin hepatitis C treatment in correctional facilities across Newfoundland and Labrador. Partnering with Memorial University School of Pharmacy and local correctional facilities, they joined the Approach study to provide confidential testing for HIV, hepatitis C, and syphilis. Lastly, I'm pleased to announce that we have partners with two strategic innovation partners, Seafair Capital and Mobia Health, in the development and pilot of Discharge Hub. Again, that's in the displays outside, at the Health Sciences Centre in St. Clair's Mercy Hospital. The Discharge Hub software provides a process that streamlines and coordinates the safe discharge of patients back home with appropriate support to meet their care needs. As I said at the outset, these are examples of improvements. There are many, many more that are deserving of mention. This is only an overview of some of the developments on the path to transformation, of which we are very proud. There are many more important initiatives and programs that we are advancing far more than we can include here. With the support of the provincial government, the efforts for transformation continue, and there will be much more to report as we proceed on this journey. I now call on our interim CEO, whom we're very proud to have with us, Ms. Karen Stone, to say a few words. It says,
good morning, everyone. Thank you, Bob. So over the last year and a half, NL Health Services has embarked on a pathway to transform the healthcare system while continuing to deliver safe, high-quality care to the people of this province every single day. The priority areas of our 2023-24 strategic plan were transformation, our people, access, and quality. To highlight some of the accomplishments in these areas, we've produced a short video detailing our path forward. I hope it works.
Health Authority, Newfoundland and Labrador Health Services. This change, as outlined in
I think we have a sound problem.
In April 2023, the 4 regional health authorities and the Newfoundland and Labrador Centre for Health Information began the transition to one provincial health authority, Newfoundland and Labrador Health Services. This change, as outlined in Health Accord NL, is leading to a more cohesive and integrated healthcare system as we deliver health services to Newfoundlanders and Labradorians. NL Health Services is responsible for delivering health services to more than 540,000 Newfoundlanders and Labradorians across the province, within a $3.1 billion budget. With over 22,000 employees, 1,100 physicians, and 1,800 volunteers, we operate in 5 geographic zones. We work collaboratively with residents, communities, and partners to achieve our vision of health and well-being. Every person, every community. Our mission statement outlines how we intend to get there, which is by working together to improve health outcomes through an innovative, integrated, and sustainable health system. Our values enhance our people and family-centered care philosophy, where the people we serve and their families are at the heart of every decision we make and every action we take. There is much work to transition to a new provincial health authority. Our first year, we established the following strategic priorities. We are proud of the performance we achieved in each of these areas during year one of the transition, and we will continue to build upon these successes. Transformation. To achieve meaningful transformation, we began establishing innovative structures to advance the integration of strategic health networks. Of particular note, we began to modernize our healthcare system so that it is integrated, more sustainable, well-balanced, and better meets the needs of the people of Newfoundland and Labrador. We also began implementation of a new health information system, marking the beginning of the largest digital health system transformation ever undertaken in Newfoundland and Labrador. Our people. Newfoundland and Labrador, like the rest of the world, has experienced a global shortage of healthcare workers. To help address this, in our first year, NL Health Services launched a recruitment and retention strategy and partnered with the provincial government on the Work in Health NL campaign to provide opportunities and incentives to attract and keep healthcare workers in all healthcare fields across Newfoundland and Labrador. This includes international recruitment efforts with missions started in various countries. Thanks to our successful retention and recruitment efforts, paired with the expansion of virtual care, the average number of emergency department closures and diversions in Category B sites was 1,081 hours, a reduction from 1,684 hours. We are continuing this work to achieve further reductions. NL Health Services has successfully recruited more than 300 internationally educated nurses to Newfoundland and Labrador since 2023 and over 160 physicians. Work is continuing to recruit physicians, nurses, and other healthcare professionals. Access. To improve access to services, NL Health Services must also be innovative in our approach to provide the most appropriate level of care and services, address areas that are experiencing high demands, and empower individuals and families with the skills and ability to understand and navigate the healthcare system. Family care teams innovatively support our work to reimagine and redesign the health system in Newfoundland and Labrador during 2023-24. The number of individuals connected to a family care team increased from 28,895 in April 2023 to 55,455 as of March 2024. The number of family care teams established doubled from 8 to 16 and exist in all areas of the province. NL Health Services increased the volume of hip and knee replacements and cataract surgeries performed in our healthcare facilities. Last year, we also implemented technologies to support booking, canceling, and rescheduling appointments. By integrating supportive services, streamlining workflows, and increasing accessibility associated with the current booking systems, we will ensure that available capacity is utilized appropriately. Quality. In 2023-24, we also began work to standardize and improve how we can promote meaningful engagement with patients, families, and communities. We are doing this work through patient and family experience advisors and community advisory committees. We believe that the people who use the health services are our equal partners. This means putting people and their families at the center of decisions, working alongside professionals to get the best outcome. Engaging clients and families as equal partners in care improves client experience and is linked to improved individual and population health outcomes. NL Health Services recognizes the value of enhancing partnerships with Indigenous communities. In 2023-24, we moved forward on our commitment to developing a culturally competent workforce, delivering culturally safe care, and addressing social determinants of health in collaboration with Indigenous peoples. As we move forward, there will be an increased focus on health equity, improved access to mental health and addiction services, and many other areas of healthcare. Thank you to everyone for your support during our first year as a provincial health authority.
So while there is still considerable work left for us to do, I think we're well on our way to achieving the goals set out in these very important strategic areas. I'm particularly proud of the work that we're doing to enhance our partnership with Indigenous peoples. This is especially timely as we get ready to observe the National Day for Truth and Reconciliation on Monday. On this day, we commemorate the children and families impacted by residential schools and help support survivors in their healing journey. I encourage everyone to take the time to learn about residential schools and to reflect on the histories and cultures of Indigenous peoples. In healthcare, it is incredibly important to be able to adapt to new technologies, advances in research, and changing demographics. We are strategically poised to be leaders for change in healthcare. As Bob has already referenced, across the hall we have a showcase of some of our many accomplishments over the last fiscal year. Several of those storyboards focus on the social determinants of health and how they contribute to our individual health and well-being. We are nearing the end of Wellbeing Week in Newfoundland and Labrador. It has been recognized in communities throughout the province. It's a time to learn about and take action around the many factors that impact our health and our quality of life. It's a week to build momentum and take meaningful steps to better our well-being. I encourage you to look at our 23-24 annual performance report. It's not as boring as you might think it is. The report, together with the showcase and video, includes information about what we've done during our very first year in operation as a provincial health authority. As we move forward with the ongoing transition, I am confident that NL Health Services will continue to deliver compassionate, high-quality health care while supporting the well-being of Newfoundlanders and Labradorians. Guided by Health Accord NL, we will continue to transform the healthcare system to improve health and health outcomes. As the interim CEO, I want to thank the Board of Directors for your support over the last number of months. My commitment to you, to our staff, physicians, patients, and clients is this: to listen, to ensure work advances on ongoing initiatives, to explore new opportunities, and to work collaboratively together through any challenges we might face. We will continue at NL Health Services to live our core values of innovation, compassion, accountability, respect, and excellence. We will support, welcome, and treat everyone with respect and dignity. To conclude, I want to extend my sincere gratitude to our employees, physicians, and volunteers for your continuous efforts to improve the healthcare system while providing kind and compassionate and high-quality healthcare. I also want to thank our patients, residents, clients, and families for your understanding and patience. I want to thank you for the valuable insights you provide and share with us, even when we're not doing everything exactly the way we should. We learn a lot for that. Thank you for your insights. And finally, thanks to everyone for being here at our AGM today. It's always good to see you. Thank you.
Thank you very much, Karen. I want to acknowledge it's been my privilege to have worked with two CEOs since we started Newfoundland and Labrador Health Services. And in David Diamond and Karen Stone, I think I've had two of the best. And I truly appreciate the support they've given the board. I appreciate how responsive they are to the things we want to know and in informing us as we go to our decisions. So thank you very much, Karen. We'll be onward and upward. I've got in my notes here to say as well, but I think Karen I already addressed it very well. I've mentioned it several times. Some of the topics referenced, along with many others, are featured in this showcase across the hall, which highlights achievements towards advancing our collective vision, health and well-being, every person, every community. At our first AGM for NL Health Services, we wanted to highlight some of the many advances and accomplishments achieved by our staff and physicians over the last year, especially as they relate to 2023-24 strategic plan. I can assure you that these presentations represent a very small amount of the incredible work that we are doing to reach our goals and those commitments outlined in Health Accord and NL. We've had some truly outstanding accomplishments this past year, and I invite you to visit the showcase if you've not already done so, and take advantage of the opportunity. Now, on behalf of the Board of Trustees, it's my pleasure to announce the storyboard that we feel stands out as an outstanding representation of the work NL Health Services has achieved over the last year. This was after many reviews yesterday by the board. I think at least 3 occasions, the entire board took the time and graded and rated all the things that were there. And as we've said many times, there are many good presentations there. But congratulations, the winner goes to the Senior Friendly Care by the Medicine Program in the Eastern Urban Zone on highlighting the great work. In highlighting the great, oh, I lost my spot here. Great work you and your colleagues have done to help achieve our goals in 2023 strategic plan, and thank you and congratulations to all the other program staff. The work you've completed this year has been truly phenomenal. Call upon the representatives of Senior Friendly Care to come forward. Congratulations.
Thank you so much. Thank you. We'll share it. Thank you.
You want to say something? It's up to you.
Thank you so much for your acknowledgement today. I will say I'd like you all to stay tuned. There's fantastic work happening with this, our senior-friendly care. We're not just looking at one unit for senior-friendly care, we're looking at senior-friendly care throughout every organization, every institute that an elderly patient walks into. We want them to be greeted with the same senior-friendly care principles that you will see soon on our ACE unit at St. Clair's. So this is a wonderful acknowledgement, but stay tuned. We're just started. Thank you.
That enthusiasm can be found throughout NL Health Services. We have visited all parts of the board, I should say, visited all parts of our service area in Newfoundland, and we are doing Labrador next month. And it's the welcome we've received at every site, the discussions we've had with so many of the physicians and other professionals in our staff. It's been absolutely wonderful. We're not getting run out of town by the people or anything like that. We're getting arms wide open, a big welcome, and how can we help you, and maybe some other suggestions of things that might help us, and they've all been very beneficial. I came out of one recently, and I turned to the other board members, and I said, I can't believe that was a healthcare meeting. It was so positive and so wonderful. And I hope that that feeling spreads throughout the whole province, because that's the way we're going to maximize what comes out of this transformation. And as my mantra has always been going through this stuff, this is an opportune time for change in well, in Newfoundland generally, but in healthcare in particular, people are ready for change. We seem to realize that there's come a time when we had to address a lot of the long-standing issues, and people are accepting it, and they're enthusiastic about it, and they're coming forward and helping us, and the staff, as you'll see from the storyboards, have jumped on board with so many innovative things. And it always surprises me when they seem to pop up to the surface. Karen probably knows about them a year before I do, but they do come up. And, you know, it is wonderful. Go and please have a look at that. So, once again, thank you to everyone for joining us for today's annual general meeting. We appreciate your interest and support, and encourage you to review our 2023-24 annual performance report. A hot item, right, Karen? Yeah. Available now on our website. We now welcome questions from those in attendance here and online, but please understand that all questions related to an organization of our size, variety, and complexity can be answered immediately by Ms. Stone and I. So we're not putting anything out there. Some things we can't put the finger on right away, but we can certainly get the answers. So, are there any questions?
Yeah, so you brought up that your greatest challenge was recruitment and retention. I'm just curious, are there any other challenges that you face in this period? How are you able to overcome them?
I'm going to refer that to Karen. She's the operating one. I only deal with policy, supposedly.
So access related, obviously, to recruitment and retention is a significant issue. We've done really good things with our family care teams, with virtual care, by connecting so many patients through Patient Connect to healthcare providers. I'd like to remind everyone, if they don't have a primary care provider, that if you register with Patient Connect, you will get access to really good virtual care through Teladoc. So if you're someone in that position, please register with Patient Connect. The virtual care work we've been doing, whether it's mobile primary care clinics, whether it's virtual urgent clinics, the infrastructure planning that we've done with respect to new urgent care clinics, new hospitals, all of those things are in the interest of increasing access.
Down the back, I'm sorry. I'm one of the people on the wait list for the cataract surgery. I can't see right at the very back. But I'm only recently. There's hope. There you go.
Thank you, Mr. Chair. My name is Madge Ackland, and I am a user of your service. First of all, I'd like to congratulate the leaders in friendly, senior kind of care. I look forward to seeing your display after. And my comments are not in the form of a question, but in the form of some advice from a client's point of view. In recent
Thank you, Madge. We really appreciate that kind of feedback. Our website at the moment is not something that we're particularly proud of, but stay tuned because new wonderful things will be coming very soon.
And I want to say that we'll be coming to you largely because of the almost immediate response from Minister Hogan's department at requests for things we want to do in the way of information, access, and communication with you. And we're joining some of the top hospitals in North America with the top ability to get that information out. And we don't want to do a whole lot more on it yet until we can put it all together in a great big package, but it's just one indication of the support that Minister Hogan's department have for transformation in the health accord. So as Karen says, stay tuned. I see two arms in the very, very back.
Thanks, Bob. We do have a question online that I'll share. Regarding strains on healthcare and what we've learned through the pandemic, are we considering implementing permanent mask mandates to reduce hospital-acquired infections from airborne viruses and other pathogens?
So I'm not a physician. That's a question that I think is best addressed by one of our medical officers of health. So we can get back to whoever asked that question today. If you have an email address for that person? And Dr. Fitzgerald as well will be able to provide an answer to that question. Sorry, I'm not comfortable doing that as a non-clinician.
Any other questions? I won't belabor the point. You're here. We do really appreciate your interest, your attention, and all input is welcome. Comment. Ideas come from you never know where sometimes, and sometimes they're the very best ones. Oh, another hand waving down back. No? Is there something else online? Oh, okay.
I'll just ask, moving into the next year, what are your goals moving forward?
To continue to provide high-quality services, to continue to implement the roadmap that's been laid out in the Health Accord and in our strategic plan, to work on quality, transformation, access, and our people, really hard every single day.
And our strategic plan was just recently released. Very recently, I was out of the province for a little while in the last couple of weeks.
Oh, yes, it's online now.
Yeah, it's online. That's available, and that sets out some of the things that are high priorities for the next year. Okay, thank you all very much. Very much appreciated. And that's it.